Well, Mark, when you look at the state's daily COVID-19 report, specifically testing by laboratory, you'll notice that some labs have 100% positivity rates. That would mean that every single test they reported was positive, no negatives. Well, the state tells us some labs made a mistake not reporting their negative test results, but at least one health system tells us they were told to only report positives. When you start at the top of the COVID-19 testing by laboratory section of the Florida Department of Health daily report, you'll see Quest Diagnostics Tampa with 548,000 test results reported, about 468,000 negative, 60,000 positive, 11% positivity. Scroll down and you'll see other percent positivity rates of 14%, 3%, 10%. But as our sister station, Fox 35, first reported, you'll spot a few 100% rates, indicating that this lab, for example, reported 464 test results, all 464 positive, no negative. In the Bay Area, we found James A. Haley Veterans Microlab, 96 positive out of 96. Morton Plant Hospital, 35 out of 35. Tampa General Hospital Clinical Lab, 25 out of 25. St. Anthony's, 22 out of 22. Important to note, some hospitals like TGH have multiple labs reporting. Their largest reports a 6% positivity rate from about 33,000 tests. So what's happening? The DOH tells Fox 13 in recent days they noticed that some smaller private labs weren't reporting negative test result data to the state. The department immediately began working with those labs to ensure that all results were being reported in order to provide comprehensive and transparent data. It's the norm and the law that if someone tests positive for an infectious illness, it's reported to the state. In a pandemic, it's the rule that negatives are reported too. All of those numbers factor into the state's percent positivity.
There were a number of labs who were just simply doing kind of what the default is, which is sending the positives only without sending the negatives. And so I don't think they were trying to be underhanded.
Advent Health CentraCare also shows a positivity rate of 100%. However, they responded that the state's direction to CentraCare was to only report positive cases.
When a 98% rate of positives comes in from a particular lab or from a particular location, the computer system should be programmed, and I'm sure it will be now, to say, time out, what's happening here? And trace it back before it's reported.
USF Health's Dr. Jay Wolfson said it's crucial that this data is published daily and that it's accurate.
Trust is such an important thing.
But he urges everyone to remember it's a daily learning process, not only on how to better treat the virus, but how to better manage it too.
The positives are positive. You know, when we do testing, we don't create positives. We simply measure them. But for purposes of controlling this epidemic, we also have to know what the negatives are so that we can keep track of what's happening in the community.
The Department of Health said it will continue educating labs on the proper protocols for reporting results. Now, we did ask the state about Advent Health's claim that they were directed from the start to only report positives. We have yet to get a response. We also reached out to the local hospitals mentioned in the story, as well as several others. James A. Haley did respond saying they're looking into it.